I'm a pediatrician and a mom, and there is currently in our community a lot of Influenza A going around. So what do you do? What do you need to look for? And do you have to take them in? So Influenza A, or B actually, but A especially, presents with high fever. So usually something over 101, as well as body aches, malaise, headaches. Little kids will just have high fevers and look miserable because they can't tell you what hurts. The bigger kids can tell you, like, my whole body hurts, I've got a headache, I don't feel good, I just, that kind of thing. There is a antiviral medication available. It's called Tamiflu. If your child is immunosuppressed, if they have underlying conditions like type 1 diabetes, if they're around other individuals that are immunosuppressed, you may consider going to your pediatrician and discussing that. The medication itself does have side effects, so we don't present it or give it to everyone, but it definitely shortens the duration of illness. So things to watch for, or when to know, when am I in trouble? Should I go to the doctor? Keep a close eye on hydration status. So making sure that your kid's mouth is still moist, that they are peeing or having close to the same number of wet diapers, that they're still able to wake up, sit up, kind of get there. If they start having higher and higher fevers, they're really not able to drink and eat, bad headache, just anything out of proportion, leg pain, weird things like that, your medical doctor is a better choice than watching at home and wondering if they're okay. But older kids especially can sometimes ride out the storm. And then you just want to make sure that you're not around other people or exposing them to it if you can. So you're safe to go back to school once they are feeling better, 24 hours fever free. Do to help your kids feel better. Hot baths with Epsom salt help with muscle aches. I use, when my kids have high fever and really don't feel good and can't drink very well, Tylenol and ibuprofen. Contact your provider to get the accurate dosing. But I think often sometimes if you're able to help alleviate some of the body aches, make the fever a little bit less severe, it just helps them drink a little bit better. If your kids don't eat for a couple days and they don't have a metabolic condition or anything underlying, I'm not too worried about that. The fluids are more important. And for that, I take kind of any fluids when kids are sick. So if that's water, if that's something with electrolytes, if it's milk, if it's juice, more important to be getting liquid in